What if your body was sending you warning signs for Parkinson's disease years, or even decades, before the well-known tremor even starts? When most people hear Parkinson's, they picture a shaking hand. But the reality of this complex brain condition is so much more than that. The disease often starts silently, deep inside the brain and nervous system, long before the classic movement symptoms show up. Many people experience subtle changes they just brush off as getting older, stress, or some other minor ailment. We now know that non-motor symptoms often show up first, sometimes by as much as 20 years. This early stage, called the prodromal phase, is a critical window of time. It's when the disease is quietly getting a foothold. Before a diagnosis is ever made, people can lose a large number of their dopamine-producing neurons. Understanding the first alerts your body sends isn't about causing panic. It's about empowerment. It's about giving you the knowledge to connect the dots and have a real talk with your doctor sooner rather than later. In this video, we're going to break down 7 surprising early symptoms that are easy to miss. By the end, you'll know what these signs are, why they happen, and what to do if you think it's time to see a doctor. The first, and one of the most studied early symptoms of Parkinson's, is losing your sense of smell, a condition called anosmia. This isn't the stuffy nose you get from a cold. This is a slow, persistent fading of your ability to smell things. Over 90% of people with Parkinson's have some level of smell loss, and it can show up 5, 10, or even 20 years before any movement problems begin. So, what's it really like? You might realize you can't smell your morning coffee anymore. Food might start tasting bland because your sense of smell is a huge part of how you perceive flavor. This can even lead to a poor appetite and losing weight. You might not smell the flowers in a garden, or, more dangerously, you could miss the smell of a gas leak, smoke, or spoiled food. Neurologists sometimes use specific scents like bananas, licorice, or pickles in a smell test. Not being able to pick out these distinct smells can be a big clue. So why does this happen? The main theory involves clumps of a protein called alpha-synuclein. In Parkinson's, these clumps, known as Lewy bodies, are a key feature of the disease. Research shows that the part of the brain that handles smells, the olfactory bulb, is one of the very first places these proteins build up. This process starts there and in the gut, long before it moves up to the part of the brain that controls movement. Now, it's really important to say this. Not everyone who loses their sense of smell will get Parkinson's. There are plenty of other causes, like sinus problems or old injuries. But an unexplained and persistent loss of smell is a major risk factor, especially if you have no other reason for it. The key is the context. If this symptom pops up alongside some of the others we're about to talk about, it becomes a much stronger signal that it's time for a chat with a neurologist. The second early symptom takes us from the nose to the gut: chronic, stubborn constipation. This is a super common problem for a lot of people, which makes it incredibly easy to ignore as a possible sign of Parkinson's. But it's also one of the earliest and most frequent non-motor symptoms, sometimes popping up as much as 20 years before a diagnosis. And we're not talking about the occasional issue you might have after eating something different. This is a chronic problem where you might have to strain to move your bowels almost every day. It's a major slowdown of your whole digestive system. The link to Parkinson's is in the autonomic nervous system. This is the part of your nervous system that runs all the automatic functions you don't think about: your heart rate, blood pressure, and, you guessed it, digestion. The same alpha-synuclein protein clumps that mess with the sense of smell also show up very early in the gut's own nervous system. This damage can mess up the nerve signals that control the rhythmic squeezing of the intestines, leading to a serious traffic jam in your digestive tract. Of course, constipation by itself doesn't mean you have Parkinson's. A bad diet, not drinking enough water, a couch potato lifestyle, and lots of medications can all be the cause. But the red flag goes up when the constipation is long-lasting, doesn't get better with the usual fixes like more fiber and water, and happens with other early symptoms. For instance, if someone over 50 suddenly develops chronic constipation for no reason and has also lost their sense of smell, the risk of them eventually developing Parkinson's gets a lot higher. It's this group of symptoms that starts to paint a more serious picture. The third symptom is one of the most specific and powerful predictors of Parkinson's disease: REM sleep behavior disorder, or RBD. This is so much more than just tossing and turning. It means physically, and often violently, acting out your dreams. Normally, during the REM stage of sleep, when you have your most vivid dreams, your body goes into a temporary state of paralysis. It's a safety feature to stop you from actually doing what you're dreaming about. In people with RBD, that paralysis switch is broken. As a result, the person acts out their dreams. If they're dreaming about being in a fight, they might punch, kick, or swing their arms. If they're dreaming of running, their legs might start churning in bed. They might yell, curse, or even sit up and have a one-sided conversation. The person sleeping usually has no idea this is happening, but their bed partner definitely does. It's often a spouse who first realizes something is very wrong. The dreams are usually intense and action-packed, often involving being chased or attacked. The movements can be so forceful that people can injure themselves or their partners. The connection between RBD and Parkinson's is incredibly strong. Studies have shown that someone with a confirmed diagnosis of RBD has a very high chance of eventually developing Parkinson's or a related condition like Lewy body dementia. Some studies suggest a conversion risk of 80% to 90% within about 15 years after RBD symptoms start. The neurodegeneration is thought to start in the lower part of the brainstem that controls this sleep paralysis, years before it hits the brain's movement centers. This is different from sleepwalking or sleep talking. A key difference is that someone with RBD can usually be woken up easily and will remember the intense dream they were just having. If a partner reports these kinds of active or violent behaviors during sleep, it is a huge red flag. A neurologist would likely suggest a sleep study to confirm the diagnosis. Given its high predictive power, a diagnosis of RBD without any other known cause is one of the most compelling reasons to get a neurological checkup. The fourth early symptom is frequent dizziness, lightheadedness, or even fainting right after you stand up. The medical term for this is orthostatic hypotension. It's that head rush feeling you might get if you hop out of bed too fast, but in this case, it happens more often and is much more intense. Basically, it's a significant drop in blood pressure when you go from sitting or lying down to standing. When you stand up, gravity pulls blood down to your legs. Your autonomic nervous system normally snaps into action, tightening blood vessels and speeding up your heart to make sure your brain keeps getting enough blood. In early Parkinson's, the damage to that autonomic nervous system can mess up this rapid response. The blood vessels don't get the signal to tighten up fast enough, blood pressure drops, and for a moment the brain doesn't get enough blood flow. This causes dizziness, seeing spots, feeling faint, or in some cases a full blackout that can lead to dangerous falls. Like constipation, this symptom is a direct result of the autonomic nervous system failing. The nerve cells that regulate blood pressure are being affected by the same disease process that underlies Parkinson's. It's important to know this is different from getting lightheaded once in a while. Being dehydrated, too hot, or taking certain medications can all cause a temporary dip in blood pressure. But if these dizzy spells upon standing become a regular thing, aren't explained by anything else, and especially if they're happening with other symptoms on this list, it points to a problem that needs to be checked out. It's a sign the body's automatic pilot isn't working right, a key feature of early Parkinson's. While REM sleep behavior disorder is a very specific sleep issue, our fifth category covers a wider range of general sleep problems. The idea that Parkinson's starts in the brainstem and affects non-motor functions first is backed up by how common sleep issues are. Long before a tremor starts, your nights can become a real struggle. Besides RBD, people in the early stages of Parkinson's often deal with a whole mix of other sleep problems. These can include insomnia. This isn't just one rough night. It's chronic trouble falling asleep, or more often staying asleep. People might wake up again and again for no clear reason, or wake up super early and not be able to get back to sleep. Excessive daytime sleepiness, EDS. This is the flip side of insomnia. Because of a bad night's sleep, or as a direct symptom of the disease itself, a person might feel an overwhelming need to sleep during the day. This isn't just a little afternoon slump. It's a powerful sleepiness that can get in the way of work, social life, and even driving safely. Restless leg syndrome, RLS. While it's its own condition, RLS is more common in people with Parkinson's. It's that awful, creepy, crawly feeling in your legs and an irresistible urge to move them, especially when you're trying to relax at night. These sleep problems are thought to come from the same early brain changes that affect the sleep-wake cycles. The disruption of brain chemicals like dopamine, serotonin, and norepinephrine, which are all involved in mood and sleep, is a core part of the disease. The tricky part is that sleep problems are extremely common. Stress, anxiety, and dozens of other things can mess up your sleep. But what might make these symptoms stand out as a sign of pre-Parkinson's is if they are chronic and show up as part of a group. When persistent insomnia or intense daytime sleepiness develops for no good reason and comes with, say, constipation or a weaker sense of smell, it makes a stronger case for a deeper look. Our sixth early symptom shifts from the physical to the emotional. The sudden onset of depression, anxiety, or something called apathy can be a direct biological sign of early Parkinson's, appearing years before movement issues. It's a common myth that the depression and anxiety tied to Parkinson's are just a reaction to getting a tough diagnosis. But the research shows something different. These mood changes are often not a reaction to the disease. They are a part of the disease itself. The same chemical changes in the brain that will eventually cause tremors are already happening. The disease affects not just dopamine, but other key brain chemicals like serotonin and norepinephrine that are crucial for regulating our mood. So, what do these mood changes actually look like? Depression. This can show up as a constant feeling of sadness, hopelessness, or losing pleasure in things you used to love. Anxiety. This can feel like constant worry, being on edge, or even panic attacks. Some research suggests anxiety and depression can become more common a few years before a diagnosis based on motor symptoms. Apathy. This is a really important and often misunderstood symptom. Apathy is a loss of motivation. It's not sadness. Someone with apathy might seem emotionally flat or just not interested in anything. They might stop hobbies, pull away from friends, and seem fine with doing nothing at all. A family member might see it as laziness, saying their loved one has lost their spark. Like other symptoms, mood disorders are common and have many causes, but the timing is key. If someone over 50 with no history of mental health issues suddenly develops depression or anxiety, it should be a red flag. When these emotional changes show up out of the blue and are paired with other signs like sleep problems or constipation, they become a much more significant piece of the puzzle. The seventh and final early symptom is one that's often not talked about because it's so sensitive: erectile dysfunction, ED, in men. This can be another very early sign that the body's autonomic nervous system is failing, sometimes appearing years before the motor symptoms of Parkinson's. Getting and keeping an erection is a complex process that depends on a healthy autonomic nervous system. This system controls the network of blood vessels, signaling them to relax and allow the blood flow needed for an erection. When the autonomic nerves are damaged by the early Parkinson's disease process, this signaling can get messed up. As a result, it becomes difficult to get or maintain an erection. It's important to understand this is a physical problem, not a psychological one related to desire, though mood changes from the disease can affect that too. Studies have shown the prevalence of ED is significantly higher in men with Parkinson's. While it's often dismissed as a normal part of getting older, its connection to autonomic failure makes it a potential early warning sign. In a broader sense, this is part of sexual dysfunction, which can affect women too, though it's been studied less. Women might experience issues like vaginal dryness or trouble with orgasm, which are also tied to autonomic nerve function. As with all the other symptoms, ED by itself is not a sure sign of Parkinson's. It's an extremely common condition caused by many things, including heart disease, diabetes, and stress. But when a man develops persistent ED that isn't explained by other health problems, and it happens alongside other early signs like constipation, sleep problems, or a loss of smell, it adds another layer to the clinical picture of potential early-stage Parkinson's. We've just walked through 7 important, often missed early symptoms. So what's the big takeaway? The most crucial thing is not to panic. Having just one of these symptoms is very common and usually isn't a sign of Parkinson's. The time to pay attention and talk to a doctor is when you notice a cluster of these symptoms. The pattern is more important than any one sign. A good rule of thumb is to take notice if you or a loved one are experiencing 2 or more of these non-motor symptoms and they aren't going away. For example, someone over 50 who has lost their sense of smell for months, is acting out their dreams, and has also developed chronic constipation, has a much higher risk profile than someone with just one of those issues. The key red flags are persistence. The symptoms aren't just here and there. They stick around for months and might be getting slowly worse. No other explanation. The loss of smell isn't from a sinus infection. The constipation isn't from a new medication. The dizziness isn't from being dehydrated. The combination. You have multiple symptoms from this list, like loss of smell plus RBD, or constipation plus dizziness when standing. If this sounds like you or someone you know, the next step is not to diagnose yourself online. It's to make an appointment with your doctor to talk about your concerns. If your doctor agrees there's something to look into, the next step is a referral to a neurologist, ideally one who specializes in movement disorders. Recognizing these signs early isn't about finding a cure, because we don't have one yet. It's about opening the door to proactive management, which can completely change how you live with the disease. Waiting until a tremor shows up means significant brain damage has already happened. But catching the disease in this early prodromal phase lets you take action. This includes access to clinical trials. An early diagnosis could make you eligible for cutting-edge trials for therapies designed to slow or stop the disease before it gets worse. Lifestyle changes. We have strong evidence that intense exercise, a healthy diet, and staying social can help protect brain function. Starting these habits early is much more powerful. Symptom management. A neurologist can help you manage difficult non-motor symptoms like constipation, sleep disorders, and depression, which can dramatically improve your quality of life right now. Planning and empowerment. An early diagnosis, while scary, gets rid of the anxiety of the unknown. It lets you and your family plan for the future, learn about the condition, and build a strong support system. New diagnostic tools are becoming a reality, including highly accurate blood tests and spinal fluid tests that can spot the abnormal alpha-synuclein protein. Some of these may even be able to detect signs of the disease years before symptoms appear. We are moving into a new era where identifying Parkinson's early is possible, and that makes paying attention to these first whispers from your body more important than ever. The story of Parkinson's disease doesn't start with a tremor. It starts with quiet, non-motor symptoms that can appear years or even decades earlier. A fading sense of smell, chronic constipation, acting out your dreams, dizziness, persistent sleep problems, new mood changes, and erectile dysfunction are all potential early warnings. While having one of these is common, a persistent cluster of 2 or more should start a conversation with your doctor. Remember, the goal isn't to live in fear, but to be an informed, proactive advocate for your own health. A diagnosis of Parkinson's is the start of a new chapter of resilience and living a full life. By listening to your body and getting guidance early, you give yourself the best possible chance to write that chapter on your own terms. If you found this helpful, please subscribe for more on proactive health. And if you or a loved one are concerned about these symptoms, please talk to a healthcare professional. Thank you for watching, and I will see you in the next video.